Hello, my name is Dr. Dewan S. Raja. Today I will discuss multiple choice questions in lower limb anatomy from question number 41 to 50. I will put all the answer keys in the description along with two of my books for your kind information. Let's start our multiple choice question. Question number 41. A 27-year-old worker fell from the roof of a condominium. The medial longitudinal arch of the foot was flattened, along with fracture and displacement of keystone bone for the medial longitudinal arch. Which of the following bones is fractured? Calcaneus, talus, navicular bone, medial cuneiform bone, first metatarsal bone. Which of these bones is fractured? Our keystone for the medial longitudinal arch. What is that? That is the talus. The head of the talus is fractured. So answer should be talus. Okay, we got that. Now next question, question number 42. Which of the following statement about the nutrient artery of the tibia is incorrect? So we'll find out the incorrect statement. A, it is a branch of the popliteal artery. It enters the tibia near the soleal line. This is the largest nutrient artery of the body. On entering the bone, it divides to give ascending and descending branches. So, which is incorrect statement? The nutrient artery of the tibia is a branch of posterior tibial artery. It is not a branch of popliteal artery. Okay, usually it is a branch of the posterior tibial artery. So this is the incorrect statement and this is the correct answer. Answer is A. It is a branch of posterior tibial artery, not a branch of the popliteal artery. On very rare occasion, it may come out of the anterior tibial artery, maybe from the bifurcation of the popliteal artery. Okay, but usually it is a branch of the posterior tibial artery. Answer is A. This is the incorrect statement. Okay, it is a branch of the posterior tibial artery, not a branch of the popliteal artery. Question number 43. The highest point of the iliac crest is situated a little behind the midpoint of the crest. It lies at the level of the interval between the spines of vertebra. What vertebra? L1 and L2, L2 and L3, L3 and L4, L4 and L5, L5 and S1. What is the answer? What is the highest point of the iliac crest? What is the level? Level is the between the L3 and L4, between the spines of the L3 and L4. Question number 44 here. How does the fibula reverses the usual pattern of ossification in long bones? It ossifies from 3 centers, 1 for the shaft, 2 for the 2 ends. The ossification center for the shaft appears at about 8th intrauterine week. The ossification center of the distal end appears begin in the appears. Okay, we can say just the okay. So it appears in the first year. Okay. The ossification center for the proximal end begins at about 3rd year in female, 4th year in male. The distal epiphysis innerts the shaft earlier than the proximal epiphysis. So what is the reverse of the usual pattern of ossification in long bone? Answer should be this. The distal epiphysis unites with the shaft earlier than the proximal epiphysis. Okay, it should not. In other bone, it should unite later than the proximal epiphysis. So distal epiphysis unites with the shaft earlier here than the proximal epiphysis. This is the reverse to the usual pattern of ossification of the long bone. So answer is E. It should not be earlier, it should be later, okay, than the proximal epiphysis. All of the following arteries contribute in the creation of an extracapsular arterial ring of the femoral neck. From there, we'll get the retinacular branches that will supply the head of the femur. Okay, so with one exception, which is not a part of the arterial ring. The exception is what? A. Ascending branch of medial circumflex femoral artery. B. Descending branch of the superior inferior gluteal artery. C. Lateral circumflex femoral artery. Okay. D. First perforating artery. Inferior epigastric artery. E. Which does not contribute in the arterial ring of the femoral neck, from where we get the retinacular branches for the head of the femur. One of them is not contributing. Okay, answer should be the inferior epigastric artery. It does not contribute in the formation of the blood supply to the arterial ring of the femoral neck. That is not a part of the trochanteric or the cruciate anastomosis. So inferior epigastric artery is an exception. That is the answer. Question number 46. Which of the following bones of the foot are vulnerable for stress fracture in athletes? Also called march fracture. Okay. Calcaneus, talus, navicular, cuboid, second and third metatarsals. Which bone of the foot are vulnerable for stress fracture in athletes or any other people who are walking short without any preparation for a long time? That may happen. Answer should be second and third metatarsal bones. Those bones may undergo stress fracture. Second and third metatarsal bones. Question number 47. Which of the following two bones forms a conical hollow called sinus tarsi? Okay, this is a conical hollow here. This is a conical hollow. Okay, you can try that. Okay, so this is the area. Okay, the conical hollow between the talus and the calcaneus, this is called the, okay, so this is called the sinus tarsi. So this is the sinus tarsi between the talus and the calcaneus, the sinus tarsi. Okay, so between the talus and calcaneus. Okay, that is the sinus tarsi. We got it. Okay. Question number 48. Which of the following tendon passes, or you can say occupied? Okay, so we can make it easy like that way. Okay, so here, okay, which of the following tendon occupies, as it is passing, occupies the groove on the plantar surface of the indicated bone. This is the cuboid bone. So this is the cuboid bone here, and here is the groove here. This is the groove of the cuboid bone. This is for the passage of the peroneus longus or fibularis longus. It turns around this bone and it is going through this groove, and it should be inserted to the medial cuneiform and first metatarsal bone. Okay, so which of the following tendon occupies the groove on the plantar surface of the indicated bone? Okay, if we make it a little larger, okay, let me try here. Okay, so this is the plantar surface. This is the cuboid bone. The cuboid bone. This is the groove. My finger is passing over the groove. Okay, groove for what? Groove for the tendon of the fibularis longus, also called peroneus longus muscle, that will be inserted to the medial cuneiform and first metatarsal bone. Medial cuneiform and first metatarsal bone. So we got that. Okay, so we got the peroneus longus in relationship to the groove on the plantar surface of the cuboid bone. This is the cuboid bone. Okay, we got that. So it is, the answer is A, the fibularis longus. Okay, then we'll go to the next question. Question number 49. A 34-year-old man was involved in a road traffic accident and received a fracture of a bony process. Which of the following tendon passes underneath the indicated bony process? Indicated means here. Okay, so what passes underneath this bony process? Tibialis posterior, tibialis anterior, flexor hallucis longus, extensor hallucis longus, flexor digitorum longus. So what passes under this bony process? What is the bony process? Sustentaculum tali. What passes underneath the sustentaculum tali? Answer should be flexor hallucis longus. Flexor hallucis longus. Okay. Next question. Sustentaculum tali is a bony projection of what? Okay. This is the sustentaculum tali here. Sustentaculum tali. We can make it bigger for you. Okay. So okay, so this is the sustentaculum tali. This is the sustentaculum tali. Underneath the sustentaculum tali, what tendon passes? This is the flexor hallucis longus. Goes along my finger. Okay, right here. So this is the sustentacular tali. Okay, so this is the area through which, underneath this bony projection, we have the tendon of the flexor hallucis longus goes to the distal surface of the plantar surface of the distal phalanx of the great toe. It is the flexor hallucis longus. It inserts to the base of the distal phalanx on the plantar surface of the great toe. Okay, we got that. So we got that. Now, and that's all about our questions. Okay, the questions of question number 41 to 50. These are my references, and I am the author of these two books. Okay, if you're interested, I will put the Amazon link in the description bar along with the answers of this multiple choice question. You may collect that if you're interested. And please support my channel. Please ask me question and share the information with your friends. Please subscribe me. Have a nice and wonderful day. Bye now.